As a community health outreach worker, I am a patient advocate and I connect patients with resources in the community. I often go to appointments and accompany patients, and really I just am like the bridge between the provider and the patient.
Anything else we need to talk about, Gladys?
Yeah, Gladys, fill them in.
Fill me in.
No,
That's pretty
all.
much it, huh?
I know you were increasing your weight, and
Well, I'm trying to keep my
Is it
weight
a
under
concern?
200, Doc.
Our complex care program consists of an RN case manager, a social worker, and a community health worker. They are embedded in our primary care clinics. They integrate within the clinic with primary care providers. We care for very high-risk patients, and those patients require care coordination across multiple specialties, as well as primary care.
I had looked in the mirror and I was combing my hair and stuff, and I said, oh my God, and I was totally yellow. My eyes were yellow, my face was yellow.
The liver is central to addressing toxicity in the body. It cleans out all the meds you take, all the foods and everything. And so when you don't have that liver functioning, people start bleeding out, they start developing fluid in the belly, they can't process their toxins, their mental status can be affected. It's essential.
I met Anthony in May of 2018, and when I first met him, he had a cirrhosis. He has diabetes, high blood pressure, high cholesterol, and his ammonia levels were really high.
There were many days that I had to come and check on him because he wouldn't answer the telephone. And I needed to make sure he was still conscious.
I met his sisters at the same time that I met him because he was just very confused and he wanted the complex care team to speak with his family.
Complex care program. I remember Dr. Lake mentioning it to us when we met Gladys and the nurse. They came to this house, and they were amazing. Both of them were amazing, and just followed through with everything. And every time we had a question or we needed, help with making an appointment, we would just call Gladys or text her, and she would take care of the situation.
There was a big concern because he wasn't really taking his medication as prescribed, mainly because he was forgetting. Thanks to the complex care team, my team, the nurse manager, and we brainstormed ways to help him remember to take his medication, and we actually used our resources here in the Hayward Wellness Center. We used the urine cup, sterile urine cups. They were clean, but that's what we had here, and we used that and a cookie sheet from his home to create this MediSet, like a medication reminder system for him. Hey, we gotta use what we have, right? Think outside the box. He still needed something else, which is a new liver. We vouched for him to be evaluated for a liver transplant consideration. The primary care clinic, as a team, we were able to be as much as a support for him as possible.
And within 2 weeks, he had a liver transplant. It was just totally amazing.
Gladys kept me on the ball, called me and told me of all my appointments. And remind me, don't forget, you got to go to the doctor on such and such a date at such and such a time. And she goes, and I'll be there with you. And I said, you will? And she said, yeah. And I thought, man. She drove all the way out to San Francisco, more than once. And she was with me for all my talks with the doctors. And she would ask questions that I would forget. She had it all written down in a binder. She's the one that kind of got me to do the operation too, because I didn't know if I wanted to do it. I was afraid. And she kept bugging me. and says, yeah, you need to do it, and this and that and the other thing. So I did. Dr. Lake was such a preventative doctor, preventative medicine, you know? He would keep an eye on everything as soon as it would happen, and then he'd keep a close eye on everything and make sure things were getting better instead of worse. And Gladys, she's been nothing but helpful. She's been just so good to me and keeping an eye on me and asking me questions all the time. She's got me going to a nutritionist down there now.
We recognized Dr. Lake and Gladys in our weekly gratitude rounds during huddle in front of the team. And Gladys said, you know, I'm just doing my job. And what I wanted to refresh with the team was, it's when we design systems and have resources in place, such as this collaboration between primary care and complex care and embedding it in the home, the medical home, then people just do their jobs and great outcomes happen. In this case, Gladys and the complex care team did a fantastic job of really dotting the I's and crossing all the T's to actually make this happen. And that's that level of detail, that level of follow-through that you need for these complex processes, and hence the name complex care.
I would like to thank Gladys and Dr. Lake for saving my brother.
I am just grateful and very privileged to have had that opportunity to help Anthony and his family. I know that because I live, other people's lives is better. And to me, that's just a huge, just satisfaction.